Topic for today is on depression. So while we all feel sad, moody or low from time to time, some people experience these feelings intensely for a long period of time. This could be prevalent for weeks, months or years. Depression is more than just low mood. It is a serious mental condition that has an impact on the physical and mental health. Let's move on to the definition of depression given by the World Health Organization. Depression can be defined as a common mental disorder that presents with depressed mood, loss of interest or pleasure, feeling of guilt or low self-esteem, disturbed sleep or appetite, low energy and poor concentration. So basically, a depressed person, they would experience a depressed mood for most part of the day. They would also encounter loss of interest in those activities that they once loved doing it. They would either feel low quite frequently about themselves. They would experience negative feelings such as I'm not good enough, I'm a failure, it's my fault, or nothing good can happen to me. So often they would have a negative thought pattern. This in turn could make them feel quite low about themselves. They would also encounter a disturbed sleep pattern or loss or increase of appetite, low energy and poor concentration. So moving on to, let's know the difference between depression and sadness. So sadness is a normal emotion that we encounter on a day-to-day basis in our daily life. It is a feeling of sorrow or unhappiness. Sadness doesn't last very long. It can be something that makes you sad that day and then you eventually get over it. While depression can affect one's mood, it can cause them to feel drained and cause someone to feel down for weeks or months. So sadness is quite temporary. We eventually get over it, while depression could be long lasting. And the person with depression is in need of medical help and support. So let's know some of the causes of depression. The first cause is biochemistry. This signifies certain chemical changes or imbalances that takes place in the brain that can contribute to the symptoms of depression. The second cause of depression could be genetics. Sometimes depression may run down in families. So that could be a family history of depression. Another cause could be personality characteristics. So people with low self-esteem could be overwhelmed by stress quite easily. They could also have low self-esteem quite frequently, accompanied with an over self-critical habit. They could also be perfectionist that could lead to much of low confidence within themselves. Another cause of depression could be environmental factors that could include workplace overload, stress, trauma, grief, childhood difficulties, factors such as unemployment, etc. Okay. So moving on to how can we diagnose depression in an individual. Here are some of the signs and symptoms that could help us diagnose depression. So each of the symptoms should be prevalent for a period of 2 weeks to detect anyone suffering from depression. The first symptoms is depressed mood most of the day. So a person suffering from depression may be depressed for most part of their day. This could be accompanied with reduced interest or pleasure in all or most activities, a significant weight loss or gain, or decrease or increase in appetite. They would also encounter trouble in sleeping or sleeping too much, psychomotor agitation or retardation. So depressed people, they would engage in movements that serve no reason. Example, they would just pace around the room without any reason, or they would keep on tapping their toes, or they would just talk rapidly without any control. They could also experience fatigue or loss of energy without any reason. They could completely feel drained out or even lazy. They constantly feel worthless or guilty, which could be quite excessive in an inappropriate manner. Okay, so certain things, certain reasons could haunt them down to such an extent that could make them feel all the more guilty. They could also encounter problems in thinking. They could illogical thinking pattern or thinking that is not rationalized. Concentration and attention span could be affected. Also, the ability to make appropriate decision can be affected. They could experience recurrent thoughts of death and depression. Okay, so people who are depressed encounter feelings which is more on the negative side. Okay, this could make them feel quite low about themselves. So let's move on to treatment. How can depression be treated? And one such cause is support. Okay, it is very important that depressed people receive support from their near and dear ones. Okay, and the first step is to identify. According to the symptoms displayed, it is easy to identify a person with depression. So the first step is to be aware of the symptoms and identify it. So immediately receiving or giving help and support to those who encounter depression is the first treatment one could give a depressed person. There are certain therapies that could help a depressed person, and one such therapy is psychotherapy. Okay, now what is psychotherapy? Psychotherapy is a way to help people with a variety of mental illnesses and emotional difficulty. It can help them to control or eliminate troubling symptoms that could enhance their well-being. And one such therapy could be counseling. Okay, so meeting a counselor could be of a great help to a depressed person. Some other methods of psychotherapy could be cognitive behavioral therapy. This therapy basically helps people to identify and change their thinking and behavioral patterns that could be harmful and ineffective, and to replace them with accurate thoughts. For example, CBT or cognitive behavioral therapy can help a depressed person to recognize and change the negative thought patterns and replace them with more positive pattern. For example, if a person complains, nothing good happens to me, So, this is basically a negative thought pattern. A therapist can help the client, help the patient to divert this negative thought pattern into a more positive pattern. Maybe helping the depressed person in knowing those instances wherein he can recollect on those things that were really good to him, something that is more positive in nature. Okay, another psychotherapy is interpersonal therapy. Interpersonal therapy basically helps people to learn healthy ways to express their emotions and improve their communication. Okay, so there are various other psychotherapies that could be administered to a person with depression. Another therapy is drug treatment, that is basically prescribed by a doctor, okay, wherein the doctor would prescribe certain medications that are antidepressant that could treat a depressed person. Now let's move on to knowing how can depression be avoided in our day-to-day life. The minute one recognizes that one is slipping off into depression, the first thing one could do is control certain stresses that's around us. For example, if at all we know that the workload is way too much and because of that I slip into depression, it's traumatizing me. Maybe certain factors that I can control within myself around me, I need to do it. Okay, maybe requesting the boss, maybe I need a break, speaking to him about how do you feel about the present situation. Okay, maybe organizing yourself in such a way that could reduce the stress. Okay, seeking support from other colleagues as well, that who could help you out in accomplishing a certain task. At the same time, balance your life with some exercise and rest. Maybe get into some exercise. It could be yoga, some kind of meditation exercises. Get into some dance therapy, Zumba, etc. Or maybe it could also be a brief walk. A walk that could just help you to divert your attention from the day-to-day schedule. And an appropriate amount of sleep is needed to keep oneself into a healthy and a balanced state of mind. Seek emotional support. The minute you realize you're being stressed out or you're feeling quite low about yourself, talk to somebody who you find way too confident in talking or sharing about your problems. Maybe it could be a partner, it could be a friend, a teacher, etc. Seek emotional support. Do not feel hesitant about talking out what you feel. You can also divert your attention by focusing on the positive aspects of your life. Okay, rather than focusing on much of the negatives of life, you can list out all those things that you were blessed with, all those good things that you once accomplished with. That could help you boost your self-esteem. If needed, also modify your schedule and set realistic and achievable goals in life. This could be some of the steps that could help us avoid depression. Okay? Now, for example, how can you help a person who is depressed? Most often, we encounter people who are depressed, would it be in our own family, in our neighborhood, maybe at the college or workplace, etc. How can you help such people out? The first thing you as an individual can do is be empathetic and understanding. Rather than being suggestive or judgmental, just try to empathize with such people. Listen to them attentively without any judgmental attitude. Sometimes listening is the best therapy you can give to someone. Just be all the more empathetic to them. Avoid any critical statements that could just shun them off or that could make them feel all the more low. Okay. Sometimes you can also challenge the expression of hopelessness because most people suffering from depression are those who have lost hope in life. Rather than giving them various examples or trying to console them, you can just give them expressions that could challenge their hopelessness. Okay, maybe try motivating them, being more supportive, and also encourage them to seek help, maybe visiting a counselor, seeking a therapist, or visiting to a psychiatrist. This is all that you can do, maybe as a friend, as a parent, as a colleague, etc. Okay. And to wind up with, we need to know that depression is a serious mental disorder that is pervasive in the world and it affects us all. Not only adolescents, but even adults, the senior citizens could experience this in their phase of life. Important is recognizing it, seeking support and help. We need to know that depression has cost-effective treatments. This can improve your health and the lives of people around the world suffering from depression. Very important is to educate ourselves about depression and also support those who are suffering from this mental disorder. Thank you.